Italian group. Dr. Professor Ruffo presents management of benign lichen sclerosus and varied penis, total benign skin reconstruction using scrotal flaps and pubic dermolipectomy.
Good afternoon, everybody. It's not the same patient they showed before. It's the new one. So we should start in a second. This patient previously underwent two failed surgery for lichen sclerosus. As you can see, there were not too much penile skin left. Urethra was invaded by lichen as well. And you can see the size of the fat pad with lots of pus and pits and nipples, so it's average. We start just to design, where we're going to do the incision. In order, this is important not just to remove the fat that now you can see in the pubic area, but it was important as well to try to achieve the best length we can just get, especially because you can see there's not too much of penile skin left. There was some music, so I can see. The problem with these patients, so many times they often have diabetes, they're smokers, so the wound healing is always compromised. I always suggest them to do hyperbaric therapy after this kind of surgery for, let's say, 2-3 cycles. It's never wrong, So we remove the fat. As you can see, we try to remove not just from the pubic area, but around the spermatic cords and at the base of the shaft, because that's important for penile length. You can see all the scarpa fascia detached. So we say the spermatic cord and penis from above. So we keep removing fat. I like the video of the colleagues before, but I always use scrotal flaps as tissues because they maintain kind of sensitivity, in the sexual intercourse. So we isolated the genital structure. Now we just proceed to removing all the tissues that is all damaged by lichen. These cases, it's always compromising between functional and aesthetic. Those patients, sometimes expectation is too high, they don't realize that the situation is pretty complex, but of course the results is good at the end. Like a previous patient, we can see the penis, it was hidden inside. Now it's the headache is just to try to cover it. I use all, as I said, the scrotal flap. I love it as tissues because it's very well vascularized, it's soft, and you can, if you just do some plastic, remove the inner layer of dartos, you can achieve a very good length. This is when there is the wound closure. I always pay attention to the aesthetic part, because our patients, they concern a lot about that. I normally use smaller stitches, but in this case, it was okay, 3-0 Lichen. That's the final appearance of the surgery. That's it.
Thank you very much for your nice presentation.